Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
We did have a question that came in. Hello, I'm a mother of a 5-year-old with ADHD, and she doesn't have a problem to go to the bathroom, but she can be sitting down for 30 minutes without doing anything. She drinks a lot of fluid, she eats salty chips, and still doesn't go. Please, I need help. This is frustrating for me.
Yeah. So, I would cut down on the salty chips because that's causing her to actually hold the urine, retain fluids. Yeah. And I would, I hate to say this, but I would increase it past 30 minutes. I mean, everyone's going to go sooner or later, and you can have entertainment in there so that she can actually stay. But I don't know that you need to be sitting for the whole 30 minutes.
Yeah.
There are a lot of, when you do the correct steps, the procedures for this, she doesn't have to be sitting for that period of time, but she shouldn't be wearing pants or a diaper or something, and then that becomes very hard for kids to hold it. Yeah. And physical movements make you aware of that.
Yeah, because the first thing that I thought of is that if, a lot of times when kids sit for 30 minutes, their legs go to sleep.
Yeah, it's horrible.
So I love the idea of, that we put them on for a couple of minutes, take them off for a couple of minutes, put them on for a couple of minutes, but we don't bother redressing them.
I mean, actually, the procedure is put them on for 15 and take them off for however long, but the issue is that, when you're not wearing anything, and if she's a little girl, 5, and you're doing this in the privacy of your own home, it is okay for her to be running around without underwear on, and it becomes very hard, actually, for the child who is running around to hold it that long, and you can pretty much tell. Yeah. But the chips might be actually forcing her to retain the liquids.
Yeah. And, you for modesty's sake, what a lot of people do is get like a long T-shirt, maybe a Big Brother's T-shirt or one of Mom's T-shirts, and you put it on. So it's like a dress. Right. And it's funny because I'm going to get in trouble for saying this, but there was a family discussion recently with one member of my family who is not necessarily loving how another member of the family is potty training because they're doing exactly this. And they were like, I've trained a lot of kids and da-da-da-da. And I said, well, actually, the experts kind of say that that's kind of the way to do it. Right. And she was like, well, but then you have pee everywhere. And I was like, no, you don't. Yeah. Because when they start to pee, you run with them to the bathroom, stick them on the potty. Right. So that they're, and maybe you have a small trail of pee. Right. But if you're paying attention, the minute the pee starts to come, you, and go to the toilet and stick them on the toilet before they're done. So you catch a little bit of it in the thing. Exactly. But they were like, you're going to have pee on everything. And I was like, no.
I mean, and Shannon, like what we used to do was that you would actually spend the time in the bathroom. Yeah. And not necessarily, like maybe in the master bathroom of the house, so like a larger bathroom that's all decorated and fun, and there's books and there's stuff. So if you do have an accident, you are in a bathroom. Yes. Just
I love how you said bathroom like it was palatial.
I know.
And all I could think about was the bathroom where we potty trained Jem, which was this, and it was the master bathroom, but it was teeny tiny, where you couldn't fit him, myself, and a behavior technician in there and have us all turn around. Like we couldn't, but it was still fun, and we made it work, and we managed it.
The first child I ever potty trained, which was, 100 years ago, was in a RV.
Right, there you go.
If you can believe it, that's where they lived. Yeah. That's where I potty trained him.
Yes, absolutely, because it can happen, it will happen.
Definitely.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.